Hello, everyone. My name is szintiaszert, and I would like to welcome you to this addiction neuroscience presentation. I decided to make this presentation after seeing, statistically speaking, how much the substance abuse numbers and amounts and the alcohol consumption amount has risen during quarantine and even now after quarantine. Globally, worldwide, in the US especially, the alcohol consumption has risen drastically. So I made this presentation. I would like to thank Dr. Alan Francis from Harvard University for allowing me to reference his slides. And so I really hope that this presentation teaches everyone, especially teenagers, because this is geared towards teenagers, about the basics of drugs and addiction. So to start with some basic definitions. So addiction is a chronic relapsing brain disease that causes compulsive drug seeking. And tolerance is when a person needs a larger amount of a drug, a larger doses, to get the same effect. So drugs are substances, and everything from nicotine to alcohol, even behaviors like internet and phone addictions, those are also actual addictions. And so dependence we call it a dependence when you have an actual physical dependence on a drug with physical withdrawal symptoms. And in the US, this is a 2017 statistic, 19.7 million people had a substance use disorder. So there are 4 steps to addiction and of addiction. So the first one is experimentation. So a person takes a drug, they have a pleasure feeling that is higher than normal, and then the people like it and they want to do it again. With number 2, tolerance. So the person doesn't respond to the same dose. A higher dose is required. That dose that they took before destroys their normal brain receptors and their normal physiological responses. And so with number 3, withdrawal, that is when you have actual physical symptoms and physical cravings to the drug. And with number 4, dependence, when the body physically needs the drug to avoid the withdrawal symptoms. So let's talk about some basic neurobiology. So neurobiology here is needed, like you have to understand neurobiology in order to understand the actual chemical behind the scenes of addiction, so to say. So neurons relate to addiction because drugs act on neurons and neurotransmitters. So neurons are where the chemistry behind addiction actually happens. So here's the cell body, the soma. So the cell body carries the genetic information, it maintains the neuron structures, and it provides energy to drive activities. And it also contains the nucleus and specialized organelles. So the next part is the axon, which is this part right here. And the axon is usually myelinated, like you can see here, which so the myelinated means it has a myelin sheath. So the myelin sheath results in faster transmittance of signals. And so the axon joins the soma at the axon hillock there. With the nodes of Ranvier, so it's these places between the myelin, the nodes of Ranvier allow for ions to diffuse in and out of the neuron, and that promotes the electrical signaling down the axon. And with the myelin sheath, as I've mentioned, so its main functions actually, I'm just talking about that because it's pretty important. So the main functions of the myelin sheath is it actually protects the neuron from other electrical impulses, so it can actually focus on its own signal. And so this is how the communication between neurons actually happens. This is like a close-up right there at the synapse. So communication of information between neurons is accomplished by movement of neurotransmitters across the synapse, which is this small gap. And so the neurotransmitters, which are these chemicals, so it's chemical signals, are released from the presynaptic terminal, and they cross the synapse, where they then are accepted in these receptors on the postsynaptic membrane. And so the receptor is like a specialized, like a site, specialized site. And so the action, the action that then follows is the activation of the receptor site. And so the action there might be depolarization, which is an excitatory postsynaptic potential, or hyperpolarization, which is an inhibitory postsynaptic potential. So let's talk about some neurotransmitters. So there are hundreds, if not thousands, of different neurotransmitters, and every neurotransmitter has its own function. These are some of the most important neurotransmitters that we have. So, for example, acetylcholine. Acetylcholine is involved in a lot of things. So like learning, as it says there, and it has also a lot of other functions. Adrenaline, you might know, which is the fight or flight neurotransmitter. And then dopamine. Dopamine is also super important, and so that is like the pleasure and like neurotransmitter. And so like if we look at the problems that, well, not problems with the neurotransmitter, but like, so as you can see here, if there is a problem with the neurotransmitter, as in if there is too much of the neurotransmitter or not enough of the neurotransmitter, then that results in a disease. So for example, as I mentioned, acetylcholine is super important. And if you don't have enough acetylcholine, then you have Alzheimer's, for example. Serotonin, if you don't have enough serotonin in your system, then you have depression. And then with dopamine is really interesting, actually, because high dopamine results in schizophrenia, but not having enough dopamine results in Parkinson's. So there you have to be really careful with the amount of dopamine that you give to a person suffering from either of those diseases. So you can pause the video and look through these areas of the brain. So one of the most important parts of our brain is the frontal lobe. That is the that is involved in like concentration and thinking and behavior, personality. So that is like our complex thinking center. So that is super important. And then the brain stem, like consciousness, breathing, if your brain stem is damaged, you are very likely to die. And then there are a lot of other parts that are also really important. So with the limbic system, so the limbic system is like a combination or like a system of structures that is near the brainstem, which I showed that is down at the bottom of the brain. So in between that, the brainstem and the cerebrum, and it is focused on emotions, and most specifically like fear and aggressions. And so the limbic system also controls the endocrine system, which are like glands and hormones for metabolism, growth, development. And so looking at certain parts of this. So this is the hippocampus. So the hippocampus is involved with memories, emotions, and navigation. And then the amygdala, which is right there, that is involved specifically with fear. So the thalamus, which is shown right there, that relays sensory impulses and motor functions. So it takes the information from the cerebellum and the basal ganglia to the cerebral primary motor area. And so the hypothalamus, which is down there, that is involved in homeostasis and body temperature. When we talk about addiction and drugs, the reward pathway is a system or parts of the brain that we cannot leave out. Really have to understand this, because all of the effects of the drugs that a person takes affect the reward pathway. So this is where like the actual chemistry happens. So the prefrontal cortex is involved with planning, complex cognitive behavior, personality expression, decision making, and it moderates social behavior as well. The nucleus accumbens is the main part of the reward pathway, and it contains dopamine, so the neurotransmitters dopamine and serotonin. And then the ventral tegmental area, which is often just called the VTA, and that is a bundle of neurons, and it also contains projections for dopaminergic neurons. And dopaminergic neurons are neurons that are involved with dopamine. So this is just another image of the brain and the exact functions of the prefrontal cortex and the limbic brain. And so let's get into our first drug that we're going to talk about. So in this case, it's nicotine. So the interesting thing with nicotine is that it is a stimulant and a sedative, which is really interesting because usually drugs either stimulate a person or they have a relaxing effect. And nicotine in this case has both. So nicotine is the primary active ingredient in tobacco. And because nicotine is both a stimulant and a sedative, that is why people use it, because it, as one, helps them relax, but it also like picks them up. And so in tobacco, 69 of the chemicals cause cancer, but there are like over 4,500 chemicals involved. And so it's not the nicotine itself that causes the cancer. With cigarettes, it's actually the smoke part and the tar in the cigarette that gets layered on your lungs. It's not the actual nicotine, but the nicotine itself obviously is highly addictive. And I just wanted to mention here that cigarette use in teenagers, focusing specifically on teenagers, cigarette use is actually going down, but smoking in itself is going up. And so I just heard this interesting lecture yesterday at the 2020 FENS virtual forum, which talks specifically about nicotine and the developing brain. And I found this information super interesting. So the cortical development of humans is not complete before the age of 20. This means that in young adults who smoke, the orbital frontal cortex, the insular cortex, and the temporal areas of the brain are affected if you smoke before the age of 20, because those are not developed fully, and they are smaller in volume. So your whole brain size is affected by smoking. And so this also means that the attentional network function in young adults is affected. And so in smokers and other like substance users, there is a drug-evoked plasticity. So plasticity means that it can like rebuild itself. There's like a drug-evoked plasticity in the ventral tegmental area, which I mentioned in the reward pathway earlier. And so there is an increase in the strength of synapses due to nicotine. But that, like the increase in strength in the synapse, is the first step to addiction. And so relating to some studies that they mentioned in the lecture that I was listening to, they tested rodents, adult rodents and adolescent rodents, and then gave them like behavior tests after 5 weeks of abstinence. And so after 5 weeks of abstinence, there was reduced accuracy and an increase in impulsivity in the adults and animals, but not in the adult animals. So basically, smoking pretty much affects a lot of things in adolescents and teenagers, but not in adults, which I found super interesting. So smoking is the most preventable cause of death in the United States, and I think in a lot of other countries as well. So even though like heroin is super addictive, it is like equally hard to quit nicotine, especially they said as like if a teenager starts smoking earlier, then the earlier you start smoking, the less chance you have of quitting smoking. It is really interesting to me that nicotine and smoking was only listed under drugs that produce dependence in 1994, which was not a long time ago. So a new study actually says that exercising might help when you are trying to quit smoking. So that is definitely worth pursuing. So this is the current tobacco use among youth. This is a 2018 statistic, the use among high school students. And as you can see, this was in 2018, 27%. So like a third of high school students use a tobacco product, which is really high. So the neurobiology of smoking. So when you smoke, the smoke first enters your lungs, obviously, and then it goes through the blood, and it actually bypasses the blood-brain barrier. So the blood-brain barrier is a system before your brain that keeps viruses, toxins, and bad things out of your brain. So very few, very specific things like substances and neurotransmitters, things like that, not neurotransmitters, but like things like that can pass through the blood-brain barrier. Nicotine passes through. And so nicotine binds to the nicotinic acetylcholine receptors, which we already have in our brain. And then sodium and potassium enter the cell. And the alpha-4 beta-2 receptors are specifically the ones that cause the addiction to nicotine in humans. And so, as we mentioned before, the reward pathway, so the nicotine travels across that, releasing dopamine. So the release of dopamine is the one that actually causes the effect. And so acetylcholine, serotonin, norepinephrine, and GABA, so many neurotransmitters are involved in this, are released, and those are activated. And through this, your arousal level is heightened. And so in an experiment where alpha-4 beta-2 receptors were receiving, like this study was obviously in rodents, but where the alpha-4 beta-2 receptors were receiving a low concentration of nicotine that was applied for 10 minutes. And then the acetylcholine current was actually reduced in the prefrontal cortex for 10 minutes, during those 10 minutes. And so afterwards, the interesting thing is that for the acetylcholine levels only return to normal after 44 minutes. And then during smoking, the nicotine receptor levels are upregulated. So that means the transmission of the signals is heightened. And so there also a certain protein, the MGLUR2 protein, is also affected by nicotine. And so when nicotine was applied to this protein, after 5 weeks of abstinence, the protein levels dropped below the control, like below the original levels, after 5 weeks of abstinence from nicotine, which is really interesting, actually. Binding sites are also upregulated. And so in rodent studies, adolescent rodents self-administer a higher doses or a higher intake of nicotine than adult rodents. So here are some effects. As we said, it also stimulates, and so it sedates also, so your stress levels decrease, but you also have a heightened arousal level, which is why a lot of people smoke. Your concentration is improved if you're addicted to nicotine. Reaction time is faster and anxiety is reduced. So with withdrawal symptoms, so a few hours after your last cigarette, or whatever you smoke, you get a craving, and then afterwards, you can get like physical symptoms like headaches, irritability, increased appetite, and even depression and difficulty focusing. So there is obviously there are physical side effects of smoking as well. As I mentioned, in the tobacco products that you use, the tar in the products is the actual cancer-causing agent. Because when you smoke, that tar goes into your lungs, it just settles onto your lungs, and then that doesn't come out of your lungs, it stays there, and that is why you can get cancer. But this is a list of side effects that it can cause. And then here is a picture of a real lung and a real heart. So in case you don't want to look at it, then please don't look. So here's a healthy lung and a tar-filled lung. So as I mentioned, the tar totally there's like many layers of tar that sit on your lungs from smoking, and then a healthy and a damaged heart. So with smoking during pregnancy, there can be a lot of problems with the development of the child. So don't smoke when pregnant. So from brain development problems to respiratory problems or other like even wrongly developed characteristics, there are many side effects. And so there is an increased risk of miscarriage, stillbirth, and like sudden infant death syndrome. There are treatments for nicotine addiction, so nicotine replacement therapy, which includes like gum, skin patches, and inhalers. And then there are two drugs, bupropion and varenicline, I think they are pronounced, that can be used as like medicine, as drugs for nicotine addiction. These are US based drugs, so I'm sure there are other ones that are called probably different in Europe and other parts of the world. And so if those are not successful, then the clonidine and nortriptyline are used. And there's also counseling and psychological support. So our second drug we are going to talk about is alcohol. So alcohol is a depressant. So it doesn't only change your physical state, but it also changes your emotional state. And so because it's a depressant, it slows your nervous system and it slows your whole reaction. So the neurobiology behind it. So with alcohol, the problem is that after swallowing, some of it is immediately absorbed into your bloodstream. And so your stomach lining is also irritated, which is why you should not, or you should drink even less before eating. So alcohol diffuses through the bloodstream and it affects nearly all of the cells in your body. So alcohol also passes through the blood-brain barrier, passes through the reward pathway, and then it releases opioid peptides, which in turn start the dopamine release. So here are some terms and words. So with intoxication, so that's when your physical or mental control is like markedly, so significantly diminished by the effects of alcohol and drugs. The really interesting thing is that alcohol's heritability rate is 50 to 65%, which is a very high heritability rate. So alcohol inhibits inhibitions, which is why you don't have control over your behavior. And the neurotransmitter involved in that, which slows or decreases the activity of your neurons, is GABA. So when I say alcohol inhibits inhibitions, so all of us have inhibitions. So certain behaviors, for example, that we would not like do in public, or certain things that, our brains inhibit us from doing. Alcohol inhibits those inhibitions, which is why you don't have control over your behavior. And so relating alcohol back to what I said with smoking, in certain studies, it's showed that smoking enhances adolescent alcohol and meth self-administration, but not in adults, only in adults. And so if you smoke, you have a higher chance of also drinking. And so there are multiple drugs that can be used. And with SSRIs, so SSRIs are selective serotonin reuptake inhibitors, and those work by enhancing the function of nerve cells in the brain that regulate emotion. And so with alcohol, if you drink while pregnant, then the child can develop fetal alcohol syndrome. So the blood alcohol concentration is the percentage of alcohol in your blood. And so here is a image of at what percentage, what behavior you use or what happens. So this is a diagram that shows the blood alcohol concentration. So how many drinks per hour, what your weight would be, and then what your blood alcohol concentration would be. And so as it shows here, a 0.4 to 0.5 alcohol concentration results in death from alcohol poisoning. So that is really serious. You can also look through this diagram on your own, but as you can see, so alcohol, as it says here, alcohol does not require digestion. And so it is absorbed into your body before other nutrients are. And so as you can see here, all parts of your body, from your brain, stomach, like it enters nearly all of your body cells, and it affects every part of your body. And here are some details that you can read through of how alcohol affects certain parts of the brain. But for example, because the hippocampus is involved with memory. And so if you drink a lot of alcohol, then you will have memory loss. And then in the long term, you can permanently damage your hippocampus. So you won't be able to memorize things and learn. So that is really interesting that alcohol can and does have long-term effects as well. So I related my statistics to Austria because I live in Austria. And so interestingly, this is in the European Union, I believe. So Austria is the only country in Europe where smoking and drinking are not declining among 15 and 16-year-old high school students, which is a pretty bad statistics. And so as you can see in these statistics in Austria in the past 30 days, these statistics are a lot higher than generally in Europe. 46% of Austrian adults smoke. That is almost half of the adult population, which is a lot. And so Austrians drink 1.1 liter more alcohol per person per year than the European average. There are many risk factors involved with alcohol and alcoholism. And so genetics is one, inheriting, so heritability, age, and obviously your social environment. So it really depends on what environment is, if they promote drinking or not. Drinking also has a lot of effects on your family as well, so just don't drink. So codependency, unpredictable behavior, and violence and abuse is most of the times linked to alcohol and drinking. So relating to this to teenagers again, so if you are involved in an accident or in a fight or something where you're drunk or drinking or have consumed alcohol, you could go to jail, which will result in a harder or less chance of getting a job or getting into college. 38%, which is really high, 38% of drownings are related to alcohol. And especially as a teenager, as I mentioned, your brain is not developed fully before the age of 20. So before your brain development is finished, the risk of alcoholism is higher. And so your brain parts are destroyed and will be destroyed by alcohol. So there is permanent damage. And this is also not just for teenagers and adolescents. This is for adults as well. If as an adult too you drink, you are causing permanent damage to your brain. So there are a lot of teenage deaths and like every year, and most of those are related to alcohol. And so the reason is because alcohol impairs concentration, reaction times, and things like that. And so here's like underage drinking and driving statistics. So 1/4 of fatal teen car accidents involve drinking. So that is a high percentage. So this lady is Jacqueline Saborido. She was an activist for or against drinking and drunk driving. She was involved in a drunk driving accident where the other driver who crashed into her car was drunk. And so she received burns on most parts of her body. So then she became an activist against drunk driving. So minor in possession. So in the US, that is 21 years of age. In Austria, it is 16 or 18, depending on what type of alcohol we're talking about. So the minor in possession is when you're legally found to be in possession of alcohol. And so that is even if you are in a car or close to alcohol. So a minor cannot touch or even hold alcohol. Here are some organizations that help people with alcoholism. So Alcoholics Anonymous is one of the main organizations. So let's talk about marijuana, also called cannabis. So 66 of the 435 chemicals that are in marijuana are cannabinoids. So marijuana comes from cannabis, which is the psychoactive form of the hemp plant. And so a lot of people believe, and there's a lot of like fake news around this, saying that marijuana is not addictive and not harmful. And that is not true. It is addictive and it is harmful to humans. So especially if you chronically use marijuana, you will get addicted. So it might be not as addictive as other drugs, but it most definitely is addictive. So the main psychoactive chemical is the delta-9 tetrahydrocannabinol, which we could just call THC. And so CBD, which is cannabidiol, also has medical effects. So it helps, for example, with people in seizures and pain relieving effects. And so like CBC, which has anti-nausea effects. And so with the endocannabinoid system, so the endocannabinoid system in our human bodies, so that is made up of the receptors, the endocannabinoid molecules, and their enzymes. And so it is a molecular system that our body uses to maintain homeostasis. And so the anandamide is our own bodily cannabinoid that binds to THC receptors. So we do have like a form of endocannabinoids in our own body, natural. And so THC inhibits the activity of hippocampal neurons. So THC dampens neural activity and it controls the levels of neurotransmitters. And so this is an image of in which parts of our body the endocannabinoid system can be found. So there are multiple steps of intoxication for marijuana. So first there's relaxation, there's sedation, mood changes, and then eventually there's confusion and fear because you don't exactly know what is happening. So THC blocks the synapses in our body, and so it slows down our neuronal activity and communication. And so marijuana's effects can last 15 to 30 days as long as THC is in the brain. Now, the problem with this is that if you smoke marijuana or consume marijuana, for example, at a party, and then you are driving 2 weeks later, and then you are stopped by the police and you get tested, because as mentioned, the marijuana effects or like the trace of marijuana can stay in your body for 15 to 30 days. So even if you are completely fine 2 weeks later, not feeling any effects, it will show up on the test. And so you can get in a lot of trouble with the police that way. If you obviously live in a state or country where it is illegal. So there are many long-term effects to using marijuana. And so after a while, you do start to lose your balance. Your short-term memory significantly decreases. And then you have slower reaction times. And these are also other effects, so bad concentration and a lot of your perceptions and balance coordination decrease in reaction times. So if you smoke marijuana, you have a 4 times as higher chance to get a stroke, a heart attack, or respiratory collapse, which is a lot higher chance. And a third of traffic fatalities every year are due to marijuana use. So here is a statistic of daily marijuana use in 2018. This is from the NIH. And so this is a graph from 10th graders to 12th graders. And so this is that the marijuana use in 10th graders and 12th graders remains stable, but there is a decline in the marijuana use of 8th graders. First of all, I don't think 8th graders should be using marijuana, but other than that, unfortunately, the 10th and 12th grade use of marijuana is not decreasing. So the next thing that we're going to be talking about is, or the next type of drug is methamphetamines, which are just called meth normally. So it is a powerful, highly addictive stimulant that affects our central nervous system. And so this is known as multiple things. So meth can be used medically. So it can be used in ADHD and narcolepsy and even obesity. But this is only used as a pretty last resort. So meth is not often used in medicine. Effects can last anywhere from 8 to 24 hours. And so the more meth used, the more addictive it is. And so meth is involved with dopamine as the neurotransmitter. So there are many physiological effects of using meth. So there's an increase in your respiration, heart rate. So that's why it's a stimulant. And so it also, because it's a stimulant, it also decreases sleep and reaction time. And then it also has psychological effects. So it causes an increased confidence and mood and alertness. And then there is decreased loneliness. But you can also get delusions of grandeur. So the problem with that is that delusions of grandeur mean that you believe that you can fly, for example, or like really extreme delusions. And the problem with that is that if you believe, for example, that you can fly, then if you are high on meth, then you might jump off a building believing you can fly, and that can cause big problems, clearly. So the problem with the street preparation of meth, well, first off, even with the addictive effects, just don't use meth. But other bad side of it is like the actual street preparation. So when preparing meth, they use highly toxic substances. So like drain cleaners, battery acids, those things are included in it. And that is maybe even more damaging to your body than the meth itself. So the medical uses are, for example, in narcolepsy, which includes like sleep paralysis or sudden bursts of sleep. And then with ADHD, so that is attention deficit hyperactivity disorder. So that is when you have a difficulty paying attention or you're hyperactive. There they use Adderall. Excuse me. And then so the problem with using meth is that per half a kilo of meth, 2.3 to 2.8 kilograms of toxic waste are created, which is a lot of toxic waste. It costs over $4,000 to clean up a meth lab, so that is also very expensive, very costly. You can use a drug therapy, so like a medicine, so bupropion therapy, which was also used in smoking, CBT, which is cognitive behavioral therapy, that is psychological. But there is no, so the bupropion therapy is used when trying to stop being addicted, like when you want to get clean, but there is no actual drug treatment that is required for withdrawal symptoms. So a type of methamphetamine is MDMA, so also called ecstasy. So it is a stimulant, but also a hallucinogen. So it alters your perception as well. And so it increases, like there's a bigger increase of release of dopamine. And so it also blocks the dopamine reuptake transporters, which mean that you have a lot of dopamine in your synapses and it can't be taken up, which is why you have an effect. So the next pictures that I will show the effects of meth use in people over the years. So as you can see, methamphetamines, and meth is like one of the drugs that extremely affects people because it is so addictive and you have to keep using more. It really has so many side effects, so many bad side effects. It destroys people, it destroys your body. So as you can see, it is not advisable to use any methamphetamine. So with cocaine, so cocaine is a stimulant. There is a crystal form, and on the streets, chalk is added to reduce the price. So consuming chalk is also increases the bad side effects of cocaine. The interesting thing is that the half-life of cocaine is only 90 minutes, so the effects only last 90 minutes, which means that you then again have to use cocaine to again feel the effects. And so cocaine works in that it blocks the reuptake of dopamine in the synapses. And so relating back to smoking, so smoking increases the smoking, like this was tested in rodents again, smoking increases cocaine self-administration. So as I mentioned, smoking increases alcohol and meth self-administration, and even cocaine self-administration. So to stop the effects of smoking, as in the consumption of nicotine. So there is a substance called minocycline, which blocks nicotine effects on adolescent microglia activation. This means that when you use this substance, this minocycline, that blocks the nicotine effect. So that blocks the nicotine effect, for example, so you don't get an increased cocaine self-administration then in rodents. So nicotine increases activity in the nucleus accumbens, which we saw was in the reward pathway. And then a receptor blockade blocks the nicotine-induced increases of the self-administration. So the blockade basically inhibits the microglia activation. So here is the history of cocaine. And so in this image, as you can see, so with cocaine, it blocks the reuptake of dopamine. So as you can see here, normally when we have neurotransmitters being released into the synapse, then they get reabsorbed or taken out, and then the signal just stops after a while. With cocaine, the problem is that the reuptake gets blocked, so it keeps staying, like it stays in the synapse, and so it keeps sending those pleasure feelings from the dopamine, and that is why you have to hide. So here are the psychological, physical, and other effects of cocaine. It can result in death and seizures. And so you can be angry, or you can have a memory of euphoria, which causes the addiction, increased heart rate, nausea, things like that. And so with side effects, so there is definitely an increased risk of stroke, heart attacks, and infarctions. There is a reduced attention. You get insomnia, asthma even, and fevers. And so with the withdrawal timeline, so as I mentioned, the half-life of cocaine is 90 minutes. So you get your first withdrawal symptoms even after those first 90 minutes. So again, risk factors are pretty similar to alcohol, for example, like genetics, environment, and the effects of the drugs. Then there are multiple treatments for cocaine, actually. So because cocaine is or because cocaine affects the dopamine levels, so L-Dopa can be used, which is also used in Parkinson's. So disulfiram, which is also used in alcohol abuse problems. And so doxycycline reduces cocaine use. And so there are other medical drugs as well that reduce the addiction to cocaine. So our next drug is heroin. So heroin is one of the most addictive drugs out there. It is derived from the poppy plant, and it in the form of morphine, it is used as a painkiller. Um, in the form of codeine, it is even used as a cough suppressant. So, but the problem is that heroin is the most abused and the fastest acting of opiates. So, when the heroin enters our brain, it is converted into morphine, and that disrupts our normal activity in our brain, and that causes intense feelings of pleasure, which is a high. So the heroin goes through our, well, the morphine actually, when it was converted, it goes through the brainward pathway. You have a dopamine surge again, like a dopamine neurotransmitter surge. And so the problem is that this is currently a big problem in many countries, that people who are addicted to opioid painkillers are 40 times more likely to become addicted to heroin. So that is unfortunately a very high statistics. So every 19 minutes, a person dies from a prescription overdose, which is really unfortunate and really sad, because opioid painkillers can be really addictive, and so you can really overdose on them. And so when someone overdoses, you can use a Narcan, which I will talk about later as well. So the withdrawal symptoms, the time in that varies. So effects are vomiting, insomnia, depression, and sweating. And so these are the signs of an opioid overdose. So if you have dizziness, confusion, if the person can't be woken up, if there's choking, if there's drowsiness, blue lips or nails. So this graph can come really in handy if in case you have to help someone who overdosed on an opioid. And I definitely advise you to stop the video and read through this. So this is how you can first identify if someone has had an opioid overdose. And then you can give them, as I mentioned, the Narcan, the nasal spray. And then it shows how after that, you should definitely call for help, call for medical help as an emergency, and how you can help the person. So first of all, you should ask the person or see if the person is awake, if they can answer, they will not wake up or such. You will give them the Narcan nasal spray. And then afterwards, you should keep monitoring the person if they don't wake up, if they don't respond, and then use it again every 2 or 3 minutes if the person does not wake up until the ambulance or help arrives. So effects of heroin, long-term effects include brain damage, liver disease, a high tolerance to it, and even death. So you can definitely overdose on opioids as well. And so these are my references. Thank you so much for watching this presentation. I really hope that I could give you a good basic or like a basis of addiction, basic definitions. The ones that are listed are the most common types of drugs that are abused and cause addiction. There obviously are a lot more. So once again, a huge thank you to Dr. Alan Francis from Harvard University for his help and for allowing me to reference and use some of his slides and images. And a huge thank you to everyone who stayed until the end of this video. And if you have any questions, definitely feel free to leave a comment or email me. And I will also link my blog below in case you have questions on there. And so I really hope that this presentation gave you some useful information. And I really hope that now, after the quarantine, or if unfortunately, again, if there's another lockdown, and in case we have to go into another quarantine episode, this can help some people. Thank you for your attention.